the surgeon or proceduralist when it's safe to resume the platinum medication. If any different, you should let your doctor who manage your warfarin or platinum medication or the anticoagulation so they can update the recommendation. Do you have any questions for the liver biopsy procedure if you are taking warfarin or other platinum medication? Leave the comment box below. Transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure if you are taking a platinum medication, such as warfarin, Eliquis, Xarelto, or Badexa? If you are taking warfarin, I would recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, you may need to fix your INR, come back in 1 week to see if it improved, and plan for the procedure. If your INR critical, you need to hold warfarin, reduce the dose, and come back in 1 week, check your INR, plan for the procedure. Anytime you hold your warfarin more than 3 days, you may consider reaching with the lobe injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the lobe injection, you should follow the doctor who manages your warfarin or the anticoagulant instructions closely to understand when you need to start the lobe injection, when you need to stop before the procedure, when you need to resume it at the procedure, when you need to stop the lobe injection quickly. If you are taking the Eliquis, Xarelto, or Badexa, you should check your kidney function, your renal labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you might need to repeat. If you have kidney disease, kidney failure, you may need to repeat the lab sooner. If your kidney function is normal, you need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days. Delay resuming. You should check with proceduralist to see if you are safe from resuming platinum medication. If any different, you should check for doctor who manage your platinum medication for the anticoagulant. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum medication, please let me know in the comment box below. Thank you. Then the tumor procedure. What should do prior to bladder procedure. If you are taking warfarin, Eliquis, Xarelto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold the warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then you may need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hope for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider switching to the low injection if you have a recurrent blood clot or stroke history and you have strong risk factor of having blood clot or stroke, then you need to treat with low injection of warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulation will give you a separate instruction for the low treatment. You should follow the instruction closely to understand when you need to stop low injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the low injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs. Make sure it's up to date. If they are more than 3 months old, then you may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you might need to hold more than 2 days. And you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You should check with the surgeon or proceduralist. Make sure if you are safe to resume your platinum medication after the procedure. If anything different, you need to discuss with your doctor who manages your platinum medication or anticoagulation. If you have any question, concern, please let me know in the comment box below. Prostate biopsy procedure. What to do prior to prostate biopsy procedure, if you are taking a blood thinner medication like warfarin, Eliquis, Xarelto, Adaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you will need to hold for 4 to 5 days prior to the. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose and come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved, or you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan reach with a lower node injection. If you have history of recurrent blood clot or stroke and strong risk factor for having blood clot or stroke. If you have to bridge with the lower node injection, you should follow the instruction from your doctor who manage your warfarin or the anticoagulant to make sure you understand when to start the lower node injection, when you need to stop for the procedure, when you should resume your lower node injection. If you are taking the Eliquis, Xarelto, or Adaxa, you might need to check your kidney function. Make sure you have up-to-date labs. If your labs more than 3 months old, then you need to repeat your labs. If your kidney labs are normal, then you may need to hold for 2 days prior to the procedure. If your kidney function is not normal, you have kidney disease, and your creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Adaxa more than 2 days. If you have normal kidney function, then you may need to resume 1 day after the procedure. If your kidney function is not normal, then you may delay to resume your Eliquis 2 to 3 days after the procedure. Your doctor who manages your platinum medication or your anticoagulant should give you a complete instruction when to start, when to hold your Eliquis, Xarelto, Adaxa, when to resume. You also need to check with the surgeon or the proceduralist, make sure when it's safe to resume the platinum medication. If they give you a different instruction than your doctor who manages your platinum medication or your anticoagulant, should discuss with the doctor or the anticoagulant. Make sure you are on the same page. If you have any further question, concern about prostate biopsy procedure, please let me know in the comment box below. Thank you. Kidney surgery or vascular surgery related to kidney. What should you do prior to this surgery? If you are taking warfarin, Alaquis, Geroto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If you have stable INR history and your INR result is at therapeutic range, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable and you have elevated INR result, then probably you need to fix your INR. Come back in 1 week to see if your INR improve, or you can plan surgery. If you have a critical INR result, then probably you need to hold your INR and use the dose. Come back in 1 week, make sure your INR improve, so you can plan for it. You have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, then you need to be breached with a low enough infection. Your doctor who manage your platinum medication, warfarin, the anticoagulation, will give you separate instruction. Make sure you understand when you should start the low enough injection, when you need to stop right before procedure, when you need to resume after the. You should follow the instruction closely. If you are taking Eliquis, Yeroto, or Badaxa, then you need to check your kidney function to make sure you have the up-to-date labs that require. If your lab more than 3 months old, then you need to repeat them. If your kidney function is normal, then you may need to hold for 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold for more than 3 days. When you are required to hold for more than 2 days, then probably you need to delay to resume. So if your kidney function is normal, you may resume the day after procedure. If it's not normal, you may resume 1 day, 2 or 3 days, depend on your kidney. You must also check with your surgeon or proceduralist to see it's okay for you to resume your platinum medication as instructed by the doctor who managed your platinum medication or the anticoagulation. If it is different recommendation, then you need to discuss with, with your doctor who managed your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking the platinum, such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you might need to hold 4 to 5 days prior to the procedure. If your INR result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for procedure. You may need to come back in 1 week to see if your INR improve, so you can plan for the procedure. And if your INR improve, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a lobenor injection. If you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to prescribe the lobenor injection, it should give you a separate instruction when you need to start your lobenors, when you stop before the procedure, when you should resume your lobenors after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. So, your doctors who manage your Eliquis, Xarelto, or Badaxa, or the anticoagulation will give you the complete instruction when you need to hold Eliquis, Xarelto, or Badaxa and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. Kidney biopsy procedure. What should do prior to kidney biopsy procedure if you're taking platinum medication such as warfarin, Eliquis, Xarelto, Adaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior procedure. If your INR history is not stable and your current INR is critical, then you need to make sure your INR back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure that your INR return to the normal range, to the therapeutic range, before they can plan for the procedure. When your INR has the therapeutic range, they will have you to hold for 4 to 5 days prior to the procedure. If you have medical condition indicated you must be breached with the Lovenox injection, then your doctor who manage your warfarin or anticoagulation, they will instruct you how to start your Lovenox injection, when to stop, when to start your Lovenox, when to stop Lovenox before the procedure, and when to resume. That's very important. You need to follow your doctor who manage your warfarin or the anticoagulant. If you are taking the Eliquis, Xarelto, or Adaxa, you may need to check your kidney function. Make sure you have up-to-date labs that require. If your lab more than 3 months old, then you may need to eat the labs. It depends on your kidney function. You may need to hold more than 2 days. If you have normal kidney function, you only need to hold for 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold Eliquis, Xarelto, or Adaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Xarelto, or Adaxa. Your doctor who manage your platinum medication or your anticoagulant will give you complete instruction when to stop and to resume Eliquis, Xarelto, or Adaxa based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when is the best time to resume. If they delay to resume your platinum medication, you need to discuss that with your doctor, manage your platinum medication or your anticoagulant. If you have any further question regarding your kidney biopsy procedure, let me know. Prior to ablation procedure. What should you do prior to ablation procedure if you are taking platinum medication or when you're taking platinum medication? Do not hold your platinum medication unless otherwise as instructed. For warfarin, you should test for INR weekly, 3 to 4 weeks prior to the procedure. Test INR weekly, 3 to 4 weeks post-procedure. Your INR must be therapeutic every week before the procedure. If for some reason your INR is not therapeutic, then you may need to restart the cycle. If you take Eliquis, Xarelto, Pradaxa, you should continue taking this medication unless otherwise as instructed. If you miss any dose, report to the proceduralist or the anticoagulation. Cardioversion. What to do prior to cardioversion procedure if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Pradaxa. Typically, you must be on platinum medication before they can do the cardioversion procedure. And do not hold your platinum medication prior and after cardioversion. You must test your, if you take in warfarin, you must test your INR weekly. You must test your INR weekly for 3 to 4 weeks prior to the procedure. And then test your INR weekly for 3 to 4 weeks post-procedure. Your INR weekly must be therapeutic or in range before they can perform the procedure. If your INR not therapeutic, not in range, they need to restart the cycle 3 to 4 weeks prior to the procedure. And then after the procedure, your INR is supposed to be therapeutic. If not, if your INR too low, they may need to reach you with a lobanor injection. For the Eliquis, Xarelto, or Pradaxa, you have to continue taking this medication. If you miss any dose, you need to report to the proceduralist or your anticoagulation or the doctor who managed the warfarin or platinum medication. So generally, you should not hold your platinum medication before and after the cardioversion, always or with after. If you miss any dose, you should let your doctor know. The surgeon or proceduralist or the anticoagulation, so they had to adjust your cycle. Most of the hospital, they prefer you to take warfarin before after the cardioversion instead of other platinum medication, Eliquis, Xarelto, or Pradaxa. If you have any further question, please let me know in the comment box below. Thank you. What should you do prior to cardiac catheterization or heart cath when you or if you taken platinum medication such as warfarin, Eliquis, Xarelto, or Pradaxa? Cardiac cath is the serious surgery, so if you take warfarin and you are stable with your INR history, or if your INR history is stable for a long time, then you should recheck your INR about 2 weeks prior to the procedure. You might need to hold your warfarin 4 to 5 days prior to the procedure. You might need to be bridged with a lower injection if you have a history of recurrent blood clot or stroke, or you have strong risk factors for increased risk of stroke or blood clot when you're off warfarin more than 3 days. If you have to bridge with lower injection, and you need to follow your doctor who managed your warfarin or the anticoagulation. Make sure you understand when to start the lower injection and when to stop right before the procedure, and when you can resume the lower injection. If your INR result slightly high, you might require to reduce the dose and recheck in 1 week, or reduce the dose and hold for 4 to 5 days prior to the procedure. For the Eliquis, Xarelto, Adaxa patient, they might need to check the kidney lab, make sure kidney normal. They probably need to update the labs if their previous labs were done more than 3 months. If their kidney function is normal, they may need to hold for 2 days prior to the cardiac surgery. If they have unstable kidney function or chronic kidney disease, and their creatinine clearance less than 50, then they may need to hold more than 2 days. If they have to hold for more than 2 days, then they might need to delay resuming the Eliquis, Xarelto, or Adaxa. So the doctor who managed your Eliquis, Xarelto, or Adaxa, or the anticoagulant will give you specific direction or instruction when to hold your Eliquis, Xarelto, or Adaxa, and when to resume. But you should check with your surgeon or procedure list to make sure when to resume, because sometimes I have bleeding after the procedure or surgery. So your surgeon or procedure list may delay to resume your blood thinner medication. Please let me know if you have any question in the comment box below. Thank you. Hello. What should you do prior to colonoscopy procedure if you are taking platinum medication, such as warfarin, Eliquis, Xarelto, or Badaxa. For warfarin, you should recheck your INR about 2 weeks prior to the procedure. If the INR is therapeutic, then you should hold your warfarin for 4 to 5 days prior to the procedure. You may need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection off warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin and reduce the dose of warfarin to get to the therapeutic before you can plan for the procedure. If your INR is slightly high, then you need to adjust the dose and recheck in 1 week if needed, or adjust the dose and plan to hold for 5 days or so for the procedure. If you have to use the Lovenox injection for bridging, then you should follow your doctor who manage your warfarin for the anticoagulation. Make sure you understand when to start the Lovenox injection and when to stop before the procedure, when to resume the Lovenox after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you probably need to check your if not within 3 months. Your Eliquis, Xarelto, Badaxa may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you may need to hold your warfarin. Excuse me. Then you need to hold your Eliquis, Xarelto, or Badaxa more than 2 days. When you need to hold your Eliquis, Xarelto, or Badaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically you resume Eliquis, Xarelto, or Badaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your aliquot Geralto Obedaxa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hope for your aliquot Geralto Obedaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your platinum medication. If your surgeon or proceduralist recommend to resume your platinum medication, you should report that to your doctor who managed your platinum medication or your anticoagulant so they can update the recommendation in the systems. If you have any question, concern, please let me know in the comment below. What should you do prior to the dental caps procedure? You don't have to hold your platinum medication prior to the dental cap. That's by your doctor who managed your platinum medication or anticoagulant. If you are taking warfarin and you don't have a stable NI and you have a critical INI recently, you might need to check your INI prior to then let your dental oral surgeon know that you have critical INI recently. If you have any active bleeding, know to make sure everything's safe. They don't do it else besides the dental caps. And if they want you to hold your warfarin prior to this procedure, then you probably need to discuss with your doctor what's in the medication or the anticoagulant or recommendation. If you have to hold your warfarin, follow your doctor or the anticoagulant instruction. You have to hold your aliquot, Geralto, or Bedaxa, then may need to stay right needed. Again, you need to discuss with doctor any recommendation or hold. If you have to hold your warfarin or aliquot, Geralto, or Bedaxa, you need to check dental when you platinum. If they don't have any instruction, idea when you need to, then you need to consult with your doctor, manage your platinum medication or your hypoacusia for the instruction. If you have no active bleeding, they may let you resume your platinum medication same day after the right. So prior to a dental caps procedure, you don't have to hold platinum medication unless otherwise instructed. Check your INI if needed. Critical INI recently or INI history not stable. You have active You should let your dental or healthcare providers, surgeon know if you have any concern like active bleeding or any major bleeding that you have in that effect or letting the medication. Okay, if you have any further question, concern, please let know in for the dental cleaning procedure. What you need to do prior to dental cleaning procedure if you are taking platinum medication like warfarin, Aliquid, Roto, Badaxa. So I would recommend that you should not hold a platinum medication for a routine dental cleaning. Um, if your iron, if you're taking warfarin, you need to make sure you are stable with your iron level. You don't have critical iron before routine cleaning. If you have critical iron, probably you need to hold your warfarin for a few days in order to get your iron to the therapeutic level. So avoid your routine cleaning if you just have the critical iron like over 5 or your iron over 6, or you have any active bleeding with over or platinum medication. For the deep cleaning, if you have to have a deep cleaning in, on the platinum medication, consider to hold your warfarin. You need to check with your doctor who manage your platinum medication. They have to review your iron history, and then they will give you some recommendation on your warfarin and your iron history. Generally, if you have a stable iron history, then and then your current iron is therapeutic, and they might recommend that you hold for 1 day prior to the procedure. Um, if your iron, if your iron is not stable and has a history of elevated iron, then they may recommend that you should hold for 3 days prior to the procedure. But they need to test your iron prior to the procedure, usually within 24 hours of the procedure. And then if you are taking the Aliquid, Yeroto, Abadaxa, and then you don't have any kind of bleeding, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine, and then you might need to hold for 1 day prior to deep cleaning. And again, if your dentist, they are not concerned about your bleeding, and then they don't recommend you have to hold your platinum medication, then you should not hold your platinum medication. You don't have any concern about bleeding. If you are stable with your warfarin doses, then you have a good history of your iron therapeutic for a long time. Then you should follow your dental recommendation. If you have concern, you should always ask for a doctor who manage your warfarin. Make sure you are safe from any procedure. Okay? If you hold your warfarin or your Aliquid, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your blood thinner medication. Generally, if you don't have any kind of bleeding or if you don't have any instruction from your dental when to resume your warfarin, then you know your doctor who manages warfarin might um, have you to resume your warfarin uh, after the procedure. But you need to double check that's safe. All right. So any further question or any concern prior to dental procedure, what you need to do when you're taking the platinum medication, please let me know in the comment below. Thank you. Bye. Hey, prior to a dental grounds procedure, what should you do if you are on platinum medication? If warfarin, Eliquis, Geroto, Badaxa, I would recommend should not hold any platinum medication prior to this procedure. Otherwise, as instructed by your doctor who manage your warfarin or platinum medication or like you should check your iron warfarin if you have a critical iron recently, if your iron history not stable, um, you have active bleeding like blood in urine, stool, cough up with blood, stomach bleeding, nose bleeding, things like that, then you need to let your dentist, dental know that you have some concern with your bleeding. And then you might need to make sure your iron not too high prior to avoid any later. Sometimes your dental may find something that may want to do additional procedure, then will cause a problem. They're not aware of critical iron or actively that if they want you to hold your warfarin prior to dental grounds procedure, then you need to discuss with your doctor who manages your warfarin or other blood thinner medication, or you need to discuss with anticoagulation sure you have the instruction. And then if they want you to hold your Eliquis, Geroto, or Badaxa prior to the procedure, for this procedure, you may need to only hold your blood thinner medication prior to the. Again, you need to talk to then your doctor who manages your Eliquis, Geroto, or up to your anticoagulator for the instruction. If you have to hold your blood thinner medication prior to the procedure, then you should ask your dental when to resume your blood thinner medication. If they don't have any instruction or any recommendation, then you need to discuss with your doctor who blood thinner medication or the anticoagulant. Generally, if you don't have any bleeding after the procedure, right, resume the blood thinner medication on the same day or a day after the procedure. If you have any question, any further question, then let me know in the comment below. Prior to the dental extraction procedure, you are taking anticoagulant like warfarin, Eliquis, or Geroto. You should
know what to do prior to dental extraction. If a simple extraction, one tooth extraction, I would recommend that whole any pertinent. But I would recommend as you are now, if you are not stable, if you are not you have a lot of out range, especially uh, higher your upper range. You should check your INA prior to avoid bleeding. So, if you have multiple tooth extractions, then I would recommend to hold 2 to 5 days prior to the procedure. You should check with your dentist or oral surgeon. You see what they expect. Some dentists, they may tell you they want INA between 2 and 3, or they want INA less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that your INA expect to be at certain level prior to the procedure. Usually, they want your INA on the day or within 24 hours prior to the procedure. So if depend if you are in excuse me, if you are in not stable or higher than the upper range, like a week or 2 week prior, then your doctor may recommend that you should hold your warfarin to make sure you get or you achieve the INA goal. Expect to be within 24 hours. So, for example, if your INA like 3.5, 2 weeks prior to the procedure, right? So, I would recommend, you need to hold your warfarin 1 day prior to the procedure, and then you need to detach the INA on the day of procedure. So to make sure you are in at 2.3, 2 to 3, that what your dentist want. If your dentist want you are in less than 2 prior to the procedure, then you might need to hold for 3 days. If you are in for 3.5, 2 weeks prior to the procedure, and you hold 3 days prior to the procedure to make sure you are not less than 2. So it still depends on what your dentist want or expect you are not level or low before the procedure. If you have to hold your INA, hold your warfarin for 5 days prior to the procedure, okay? Sometimes they have difficult or multiple tooth extraction. They may want you to hold for 5 days prior to the procedure. They want the INA level less than 1.5. And you need to hold your warfarin might be for 5 days or more, depending on your INA level. So you have to follow your doctor closely to make sure don't have any bleeding. So if you have to hold your warfarin for 5 days to get the INA at less than 1.5, then you may need to be reached with the lower knob injection or inoxaparin injection to avoid, the blood clot or stroke that you take warfarin to prevent the blood clot or stroke. And then if you require to reach with the Lovenox injection, there is instruction, when to start the Lovenox and when to resume Lovenox injection. You have to follow the doctor who manage the doctor who manage your warfarin. If you take Eliquis, Xarelto, or Badaxa, it's easier to manage prior to the procedure. Generally, for a simple extraction, you don't have to hold Eliquis, Xarelto, or Badaxa, but for multiple tube extractions or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be rich with the Lovenox injection when you hold less than 3 days. I think generally it's safe. It's safe for certain patients. They are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that's a very complicated patient. Need to work closely. They may need to be stay at the hospital before the procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the Eliquis, Xarelto, Badaxa, then resume your blood thinner medication as instructed by dental or the surgeon. So, prior to the dental extraction procedure, you need to know if that's a simple extraction or multiple tooth extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tooth extraction or extensive oral surgery, then you may need to hold your warfarin for 2 to 5 days, depending on your I9 level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the Lovenox injection to make sure you are safe from blood clot or stroke. And if you take an Eliquis, Xarelto, or Badaxa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. Then you should resume your blood thinner medication as instructed by your dental. And if you have to be breached with Lovenox injection, then you have to follow your doctor who manage your warfarin to make sure what day you need to start the Lovenox and what day and when you resume your Lovenox and when to start the Lovenox injection. All right, if you have any further questions for this dental extraction procedure, please let me know in comment below. Thank you. Prior to dental fillings procedure, what should you do if you are on blood thinner medication, such as warfarin, Eliquis, Xarelto, or Badaxa? You don't have to hold your blood thinner medication prior to a dental fillings procedure, unless otherwise as instructed by your doctor who managed your warfarin or your anticoagulation or um, your dental or your oral surgeon. Okay, if you have a unstable, have an unstable INR history, then you may consider to reject your INR. If you have a critical INR recently, then you should check your INR, make sure your INR is not too high prior to the procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do, they need to postpone the procedure, this procedure, because you have bleeding, why not too high? But if you need to talk to them to make sure they don't do anything else besides the fillings. They require you to hold the warfarin, and you need to follow your doctor who managed the blood thinner medication or the anticoagulation. And if they require you, if you're taking the Aliquix, your Rotor by that time, and they require you to hold your blood thinner medication, okay, prior to the procedure, you have to hold. And if you have to hold your blood thinner medication, then you resume your blood thinner medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who managed your blood thinner medication or the anticoagulant, and you should resume blood thinner medication. If you don't have any higher bleeding after the procedure, then might resume the blood thinner medication the day after the, or even same day of the procedure, you have no bleeding done. All right, so again, before a dental fillings procedure, you don't have to hold any blood thinner medication. That's otherwise struggling. And then you don't have any stable INR history, critical INR recently, then check your INR to the bleeding risk procedure. And I just say for the fillings, do not worry about INR history bleeding. But if they have live retinal bleeding, probably do anything. Hospital eye, they have a basal agent push the bleeding back to normal. All right, if you have any further question or concern prior to a dental, please let me know in the comment below. Thank you. Before a dental root canal procedure, what should you do if you are on blood thinner medication, such as warfarin, Aliquix, Geroto, Bodaxa? I would recommend you should not hold your blood thinner medication. Otherwise, as instructed by your doctor or your anticoagulant. If you have unstable INA history. Your recent INA was critical, too high, then you should check your INA prior to the procedure. Make sure you are safe from the procedure. If your INA is therapeutic or you have a history of stable INA, good INA history, then you don't have to hold your warfarin prior to, unless otherwise as instructed by your doctor who manages your warfarin or the anticoagulation clinic. Or if your dental or your oral surgeon recommend that you hold your blood thinner medication, then you need to discuss with your doctor who manages your warfarin or the anticoagulation to make sure that you hold the blood thinner medication appropriately. So if you have unstable INA history or your INA was critical recently, you should check your INA, make sure you are safe. And if you have any active bleeding, you should let your doctor or your anticoagulation clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine. You should let your doctor and your dentist or oral surgeon know before the procedure. Your dental or your oral surgeon may request or may require you to hold your warfarin or your Alaquickia or Badexa. So if you require to hold your warfarin, work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the INA level they want for a procedure. And then if you require to hold your Alaquicks, Eroto, or Badexa, then I would recommend you should hold for 1 day prior to the procedure. And if you have to hold your warfarin or your Alaquick, Eroto, or Badexa, then you need to resume your blood thinner medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, you need to check with your doctor who manages your warfarin or your anticoagulant to see if they have it. If you have any further question or concern prior to a dental root canal procedure, please let me know in the comments below. Prior to dental scaling procedure, so what should you do when you are taking a blood thinner medication, that warfarin, Eliquis, Xarelto, Adaxa? I would recommend you should not hold blood thinner medication otherwise as instructed by your doctor who manages your warfarin or your clinic who manages your warfarin. Or your clinic who manage Alaquis, Xarelto, or Adaxa. If you are taking warfarin and you have unstable INA history, then you need to check your INA to make sure you are not critical prior to a procedure. So if you have a critical INA, you should hold your warfarin until your INA back to the therapeutic level or below your range, be safe for procedure. Um, if you are stable with your girlfriend and you have a good INR history by, in rent for a long time, and you may not hope your platinum your girlfriend. Okay? If you don't have any active bleeding or any concern about bleeding, and you don't have to hold your platinum medication prior to dental scaling. If you have to hold your platinum medication prior to the procedure, as instructed by your dental, then you need to resume your platinum medication instructed. Make sure uh, have a bleeding can control your blood clot and stroke if you don't not if you take too long to boom for platinum medication. So that's one way you need to check your dentist or your oral surgeon to make sure that they have any instruction for you for the procedure. Um, Let them know that you are on platinum medication if they have any instruction. If they have no concern, no instruction, then you should check with your doctor or the anti-coag clinics, make sure they have a recommendation, safe procedure. Again, I would not recommend take platinum medication before a dental scaling procedure, unless otherwise as instructed by your dental. Um, if you are not stable, if your warfarin doses, you have unstable INR history, and uh, have the critical INR recently, and you should talk to your doctor or your anti-coag clinic. Uh, Make sure that they give you good instruction what to do with your platinum medication prior to. And then after the procedure, you resume the platinum medication as instructed by your dental. You don't have any instruction if they don't know what to recommend, then you should follow the doctor or your anti-coag clinic recommendation. Safe. Resume the platinum medication perfectly. You have any further question or concern about before dental scaling procedure, what you need to do, and you are on platinum medication? Thank you. Prior to a total knee replacement surgery, so what should you do if you are on platinum medication? If you are taking warfarin, then your doctor who manage warfarin for the Formulary clinic, they might reject your INR about 2 weeks prior to the procedure. Depending your INR result or your INR history, then if it's too high, then they adjust your warfarin dose and have you to get in 1 week. And then if you are getting better or get into the range, then they may hold for often for 4 to 5 days prior to the procedure. And if you have a history of recurrent recurrent blood clot or current stroke, and they might need to bridge you with the low injection. And so when they have to bridge you with the low injection, they need to make sure you have up to days kidney labs, within 3 months of kidney lab, and then your current weight in order to dose Lovenox. There are some instructions regarding when to start your Lovenox injection and when to resume your. You need to follow doctor or make sure you reach the Lovenox correctly. And then if you take adequate Geroto Badaxa, your doctor, excuse me, your doctor who managed your blood thinner medication or the anticoagulant might check your kidney function. They need to update the labs needed, usually within 3 months, and your labs okay. But if it's over 3 months, then they should recheck your kidney labs, your renal labs, so they can give you the good recommendation. If you have a normal kidney function, then probably you would need to hold for like 2 days prior to the total replacement surgery. If your kidney function, if you have some kind of acute kidney problem or have a chronic kidney disease, then based on your create screening clearance, and they recommend that you might need to hold more than 2 days. So if you have bad kidney function, then you might go 3 days off, depend on your. And then if you have to hold your warfarin for 5 days, your Aliquid for 2 days or more, your Yeroto Badaxa days or more, then you need to check with your surgeon or the proceduralist to see when you can resume your blood thinner medication. Generally, for warfarin, you may resume your warfarin a day after procedure if okay with the surgeon. And then for the Aliquid, Yeroto Badaxa, yes, the same thing. You may need to resume this medication a day after the procedure. But if you have a bad kidney function and you have to hold more than 2 days, then probably you need to resume your Aliquid Yeroto Badaxa maybe 2 or 3 days after the procedure. Again, you follow your doctor or the anticoagulant who manage your blood thinner medication and your surgeon or proceduralist. Have any further questions or concerns? Let me know in those.
Hello, Yangping. This is a very good question. A lot of people ask me this question when I manage the comedy clinic. Yes, some people have to take both warfarin and aspirin. But not a lot of people. Some people have to take both warfarin and aspirin. Aspirin generally take for the platelet, or certain patient have the AFib, but they don't have additional factors. So they only need take aspirin. But when they have additional factors like over 75 or have diabetes. So generally the gap tubes are over 2. They should take the anticoagulant instead of take only aspirin. But some people have to take aspirin and warfarin because they have additional conditions. For example, people who take warfarin for the AFib, and they have to take maybe aspirin for the stent. People who have the stent in their body, they may have to take aspirin for 1 year or so. Some people have to take the other antiplatelet, like Plavix. So, depending on your medical history, your doctor or your pharmacist will reveal whether or not you should take both aspirin or warfarin. Thank you for your question. Do you have any other further questions? Please let me know. Thank you. I am thinking, this is another good question. I think generally for the major procedure or surgery, I would recommend to hold aspirin for 7 days, but you need to check with the heart doctor to make sure they are okay for that. Hello, Yajib. This is a good question. What is the difference between both? I don't know. I say Motrin is a non-formulary steroid. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that. Whereas Tylenol is used for non-inflammation pain, like my headache or my fever or my headache. But just pay attention on all the side effects for each of these medications so you profit. So, Motrin may affect your stomach like ulceration when you use very high dose or you take it in empty stomach. your kidney also. So when you take Motrin, you have to take with a full stomach, and you can take 15 or 13 minutes after eating. And Thailand, it may affect your liver. So you should not exceed 4,000 milligrams of Tylenol for any circumstance. So generally, you take 500 to 1,000 every 4 to 6 hours, but do not exceed 4,000 milligrams a day. May affect your liver, especially if you have any liver disease. You should consider heavily when you take in Tylenol. And when drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. For those, this is very important to consider when you should take Tylenol or Motrin. That's pretty much, what's different in Tylenol and Motrin. If you have any further questions, please comment below. Let me know. Thank you. Hi, friend. It's a good question. Basically, this is a general question I used to have. Typically, as you know, we should not take Motrin while we are on warfarin, because Motrin is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant, such as warfarin or Eliquis, Yeroto, any type of anticoagulant. We should not take Motrin. So if you are not allergic, not allergic to Tylenol, you should take Tylenol instead of Motrin.
All right, so last medication is warfarin, Coumadin. So when you should not take warfarin, you should not take warfarin if not recommended by your doctor or pharmacist. Okay, if there is no clear indication for you to take warfarin, clear indication like deep vein thrombosis, pulmonary embolism, fibrillation, or AFib. This is a very clear indication. Warfarin. You should not take any active bleed, any warfarin if you are, or if you have any active bleed, like stomach bleeding, nose, or blood in urine. Did not start warfarin. You have active.
or significant or major bleeding. You should discuss with your doctor or your pharmacist to make sure they give you the right doses, or they start with a lower dose instead of normal or higher dose, because the warfarin dosing is very complicated. Make sure you ask your doctor and your pharmacist to have active bleeding or you have a history of major bleeding. Warfarin. And if you have been taking warfarin and you should have the active bleeding, that you need to report to your doctor. They stop it. And if you have life-threatening bleeding, then you need to stop warfarin right away and go to the emergency for further evaluation. And you should not taking warfarin with other blood thinner medication like Aliquid, Xarelto, Rexa. They blood thinner medication, you should complicated medication. If you about switching from warfarin to Aliquid or switching from the other blood thinner medication to warfarin, then there may be some overlap for a few days. For example, if you're switching from Aliquid, warfarin, then you need to overlap the Aliquid and warfarin for 3 days, or you stop the Aliquid. Make sure warfarin start working in your body after 3 days, like that, but not in together in a daily basis. So your prevent your blood. And when you on warfarin, or you are new to warfarin, and you've been taking the Plavix, and you should check with your doctor to make sure if you still continue on the antiplatelet like Plavix or aspirin. You need to check, make sure you still need to take Plavix or aspirin. And if you have been taking warfarin, then they just start a Plavix or aspirin, then you need to let them know you're on warfarin. Make sure the Plavix or aspirin they want to start, you need it. Sometimes it's not. Sometimes they don't know if you are on warfarin or blood thinner medications. It just start you with the aspirin. Some people have to be on both Plavix or warfarin or aspirin and warfarin because they have different indications. To make sure you don't have to take the medication that you not take. Prevent suicide. You should not take warfarin if you're allergic to it. And then one more thing for the warfarin. So typically, you should hold 4 to 5 days prior to the major surgery or procedure, colonoscopy, knee replacement, or multiple dental extraction. So you should hold 4 to 5 days prior to procedure. That normally, and presuming that, presume that your iron level is at the therapeutic level. And if your iron level, at the supra-therapeutic or out range, then we'll have hold your hold your warfarin accordingly. that is different topic, very complicated. And then, after the procedure, then you ask the surgeon or the proceduralist, make sure that if it's okay to resume your warfarin, maybe 1 day or 2 days after the procedure, if no bleeding. So I would recommend patient to check with the surgeon or the doctor who will perform the procedure, make sure when it's okay to resume warfarin. So this is very important information for people who have to take warfarin or who have been on warfarin. And when you should report to your doctor, and when you need to go to the emergency room because of bleeding, high patient, and when you then what medication you should avoid. Check with your doctor or pharmacist. Every time you have a new medication, doing over-the-counter herbals, vitamins, check for the drug interaction. That many drugs interact with warfarin, either decrease the efficacy or increase efficacy. Both affect warfarin and affect your body. You check with your doctor and when you have any kind of bleeding, you need to report to the doctor, or even you just have abnormal bruising, check with your doctor. You may have too much warfarin in your body, or you may have or eat any food that increase iron or increase bleeding. Just make sure you report to you. And pay attention, and sometimes they switch you to a new blood thinner medication, Aliquix, Geronto, then I need to stop warfarin. When you start a new blood thinner medication, Aliquix. Make sure that you stop the warfarin if as instructed before any major surgery. Otherwise, they have to postpone your surgery or procedure. You have to wait for a long time. All right, so that is some information that you need to pay attention when taking warfarin or after warfarin. Have any further question or clarify anything? Please let me. Right. Next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But yes, you can do that. But if you don't have any additional medical condition, or if don't know how much you should take, like that, then you need to ask your doctor or pharmacist to make sure you understand clearly or you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it may affect when you take with Tylenol, it might fever. You take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol, drinking too much alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your partner, because it may affect your liver function. And then do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, you know the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you are on, blood thinner medication like warfarin or Aliquid, but that's it's okay for you to take Tylenol. It's safe to take compared to other pain relief medication. And so, and then the last one is you should not take Tylenol if you are allergic to it. So, be very important information about Tylenol, when and what you should take, and then what you need to pay attention. Caution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right, so the next medication is fish oil, omega-3. So the omega-3 or fish oil you can buy over the counter, and it's generally safe to take, but I would recommend that you should check with your doctor to make sure you take it correctly. And I would not recommend that you should take the fish oil if it's being expired. You should make sure that it's not expired, so you take the good product. If it's expired, it might cause problems. When it's expired, it's no longer effective like it should, but it increases side effect, like bleeding or cramps, nausea, things like that. The main side effect or bad taste, bad smell. It might contain harmful bacteria. When it's expired, it may leaking or broken. You may experience some bacteria. And some research indicate that it may lead to increased risk of cancer. Expired. Make sure you check the expiration day and take it correctly. Also, you should store the medication in the appropriate location, not too cold, not too hot. Make sure the medication work like the way it should. You should not take the fish oil if you have any active bleeding. So the stomach, you have stomach bleeding or nose bleeding, blood in urine, cup of blood, or if you have after you take fish oil, you have bleeding, or you have any kind of lab or dairy stool, then you may need to start taking fish oil. And you should not start when you have any active bleeding. That's very important. The fish oil itself may increase risk of bleeding, may cause bleeding. And you should not take fish oil when you taking warfarin and having critical or elevated iron level. If you have iron level about 5 or 6, it might very dangerous. When you take fish oil, it increase risk of bleeding. And you should not take the fish oil to taking other blood thinner medication like Aliquid, Eroto, Alexa, or the antiplatelet like aspirin or have bleeding or low hemoglobin. Those factors very important to consider whether or not you should continue taking fish oil or stop the fish oil. If you have any of these factors, you need to check with your doctor or your pharmacist to make sure that you don't do any increased risk of bleeding problems. And then if you want to take the fish oil, you should not take more than 2,000 milligrams a day without clear indication. Now, if somebody have some sort of increased cholesterol, then they might take about 2,000 milligrams a day. But if you take more than that and you don't have any clear indication or recommendation, then you should not, because there's increased risk of bleeding, or it may have other side effects. So I would recommend that you should check with your doctor if you want to take more than 2,000 grams of fish oil a day. And do not take fish oil if you're allergic to it. Okay? It's very important information, and not a lot of people know about this. I've been working on anticoagulant for a long time, dealing with this supplement a lot.